Assalamu alaikum brothers. Today I have completed 4.46 kilometers and burned 445 kilocalories. So today we see a lot of diabetic patients. So 4 out of 10, around 40% of the population is now diabetic. So it's growing very fast. So we call this type 2 diabetes. So type 2 diabetes that now you can get at any age. So if both parents are diabetic, so the children can get at the early age, so the diabetic. So once we diagnose the diabetic, that means the 40% of the insulin body secreting, the insulin is reduced. So the body, our body, there are pancreas, so there are islands, so Langerhans islands, so beta cell secretes insulin. So when a patient diagnosed to be a diabetic, so 40% of the insulin is reduced in his body. So we give some medicines to increase the activities of the insulin and also increase the secretion of the insulin. So as it goes, when the patients are go by 10 or 12 years of diabetic, the total body insulin is reduced. So at that point, we need to start the insulin. So insulin is artificially, so that we have to give it by injection. So it's very common, right? But people are very reluctant to get the insulin. So insulin, they are not willing to get it. So once they are long history of diabetic, definitely they need a insulin. So in some point, the tablets, it won't work. So they are reluctant to get the diabetic. Patients are reluctant to get the insulin, but definitely if they want to control the diabetic, at that point they need insulin. There are various type of insulin we call soluble and the mixed start insulin, long acting insulin. So according to the requirements, so mostly the patients are prescribed mixed start insulin. So once they need very quick control, we prescribe them soluble insulin. So whatever the insulin, they some point the patients need to take it. So don't be reluctant to get it the insulin. If you get the insulin only, you can control the diabetic in some point. So when the patients prescribe the insulin, they should not be reluctant to get it. So once you get the insulin only, you can control the diabetic in some point with other life modifications and diet control and some other medicine. Not only the insulin, with insulin they will get some oral hypoglycemic drug, that means diabetic medicine also they have to get it to control the diabetic.